Understanding mastitis and inflammation problem. Mastitis is a common problem in dairy cows. It's an inflammation of the udder, the part of the cow that produces milk. This inflammation is often caused by a bacterial infection. Mastitis can affect one or more quarters of the udder. It's a serious issue because it impacts the cow's health and the quality of the milk. When a cow has mastitis, the milk-producing tissues inside the udder get irritated and swollen. This inflammation makes it difficult for the cow to produce milk normally. The milk itself might look different too. It can become clumpy, watery, or even have blood in it. Mastitis is a big deal for dairy farmers. It's not just about one sick cow. It can spread through the whole herd if we're not careful. That's why understanding what causes mastitis, how to spot it, and how to prevent it is so important. The most common way cows get mastitis is through bacteria. Think of the teat end as a doorway to the udder. If bacteria get past the teat opening and into the teat canal, they can infect the udder. These bacteria usually come from the environment. They might be present in bedding, manure, or even on the milking equipment. Cows can also pick up bacteria from other infected cows. Sometimes an injury to the udder can make a cow more susceptible to mastitis. A cut or scrape can create an easy entry point for bacteria. Even something as simple as a cracked teat can allow bacteria to sneak in. Good hygiene is crucial in preventing mastitis. Keeping the cows clean and dry, especially around the udder, helps reduce the number of bacteria present. Regularly cleaning and disinfecting milking equipment is also essential to minimize the risk of contamination. Once bacteria enter the udder, they multiply rapidly. They irritate the delicate tissues inside, leading to inflammation. The body's natural defense mechanisms kick in, sending white blood cells to fight the infection. This immune response is what causes the udder to become swollen, red, and painful. The milk-producing cells within the udder are damaged during this process, reducing the quality and quantity of milk produced. In severe cases, the infection can spread throughout the udder, leading to systemic illness in the cow. This can cause fever, loss of appetite, and lethargy. In extreme cases, untreated mastitis can even be fatal. Section 4. Spotting the signs. Symptoms of mastitis. Early detection of mastitis is crucial for effective treatment and to prevent its spread. There are several signs that farmers and veterinarians look for when checking for mastitis. One of the most obvious signs is swelling of the affected quarter. The udder might feel hot and firm to the touch. The cow might also show signs of pain, such as kicking or restlessness, especially during milking. Changes in milk are another significant indicator. The milk from an infected quarter might appear watery, clumpy, or discolored. It might also contain blood or pus. A decrease in milk production is another common symptom, as the infection disrupts the normal milk-producing processes. Section 5. Diagnosis. Figuring out the problem. Diagnosing mastitis involves a combination of physical examination and laboratory testing. When a veterinarian examines a cow suspected of having mastitis, they'll carefully check the udder for any abnormalities. They'll feel for swelling, heat, and pain. They'll also examine the milk for any changes in appearance or consistency. To confirm the diagnosis and identify the type of bacteria causing the infection, a milk sample is sent to a laboratory for analysis. This helps determine the most effective course of treatment. Section 6. Treatment and beyond. Combating mastitis. Treating mastitis typically involves a combination of antibiotics and supportive care. Antibiotics target the bacterial infection, while supportive care focuses on relieving the cow's discomfort and promoting healing. Antibiotics are usually administered directly into the affected quarter through the teat canal. This ensures the medication reaches the site of infection. In some cases, systemic antibiotics might be necessary, especially if the infection has spread beyond the udder. Proper milking procedures are essential during treatment. Milking the infected quarter frequently helps remove bacteria and inflammatory substances from the udder. It's also important to discard milk from the infected quarter, as it's not safe for consumption. Section 7. Prevention is key. Keeping the udder healthy. Preventing mastitis is far more effective than treating it. Implementing good hygiene practices on the farm is crucial in minimizing the risk of infection. This includes keeping the cows clean and dry, especially around the udder. Regular cleaning and disinfection of milking equipment are essential. This helps prevent the spread of bacteria from cow to cow. Dipping teats in an antiseptic solution after milking creates a barrier that helps prevent bacteria from entering the teat canal. Regular checkups by a veterinarian are also important. The vet can identify early signs of mastitis and recommend preventive measures tailored to the specific needs of the farm.